From building 2 new hospitals to the deployment of thousands of doctors and nurses, China is taking vigorous measures to stop the spread of the coronavirus. Hello, I'm Anand Naidu, and this is The Heat. The World Health Organization warns the entire world must take action to contain the coronavirus. The death toll from the new coronavirus is more than 130, with the number of confirmed cases in China above 6,000. Most of them have been in Hubei province, in the epicenter of Wuhan. The virus has spread across China and been confirmed in at least 16 countries, with about 70 people infected. CGTN's Roy Ruttenberg takes a look back at the first signs of the outbreak and where we are now.
It was flu season in late 2019, and a number of people in Wuhan in central China's Hubei province exhibited typical signs: cough, fever, shortness of breath. But some, a small number, didn't respond to the usual treatment regimen. They developed pneumonia and required hospitalization. On the last day of the year, Beijing alerts the World Health Organization and says several of the infected worked at a wholesale seafood market in Wuhan.
Most of the time, animal viruses don't get taken up by humans, and human viruses don't make animals sick, but viruses are constantly mutating. So if a virus mutated in a way that let it spread to a human, and you've got these humans and the animals all crowded together in a marketplace, we can have an emerging infectious disease event.
The market is shut down. A week later, Chinese officials, ruling out a reoccurrence of the 2002 SARS, announced they've identified a new coronavirus.
One of the things that was really impressive about the scientists in China was how quickly they actually isolated the virus and then obtained its genetic code. That happened within a period of a few weeks. That's an amazing accomplishment. It's a heroic accomplishment and a testament to the power of Chinese science, because in the past, in 2002, 2003, that whole sequence of events took almost a year.
China confirms its first death. Then Thailand reports its first infection, a woman who arrived from Wuhan. Within days, China confirms a second death, and the U.S. announces screenings at 3 airports. It later expands screenings to 5 locations and says all passengers originating in Wuhan would be rerouted through those ports of entry. More countries confirm infections in the U.S., France, Australia, Malaysia, Singapore, Nepal, South Korea, and Vietnam. Several international airports in Asia and some elsewhere introduce mandatory screenings to identify infected people and to separate them from the general population.
Every flight from China now is being met by border security officers who are going on the plane and distributing information to every passenger, trying to identify any unwell passengers.
The UK asks anyone who arrived from Wuhan to self-isolate, stay indoors it requests, and avoid contact with other people. Cambodia then confirms its first case and asks people who have returned from Wuhan and are experiencing symptoms to urgently seek medical treatment. The Netherlands, Spain, and UK announce they're looking at options to evacuate their nationals from Wuhan, the lockdown city of 11 million people. The US, Japan, Germany, and France say they're scheduling flights to extract citizens from the region.
In order to avoid the spreading of the virus on French soil, the people who will be flown back will be followed by medical teams and will spend 14 days at a housing facility.
Africa's Centers for Disease Control activate a continent-wide emergency operations center, but some want more action.
There are a number of Ethiopian students in the Wuhan province in China. Many other countries started evacuating their citizens because they have the capacity to evacuate their citizens. The government of Ethiopia should work together with the African Union and the UN to evacuate our citizens too.
In Russia, tourist operators stop selling China trips. In South Korea, Chinese tourists line up to stock up on face masks due to a shortage back home. And Malaysia introduces a temporary ban on tourists from Hubei. Mongolia closes its land border with China, shuts schools, and cancels conferences and public events. This week, Germany confirmed its first domestic human-to-human transmission. Another such case reported by Japan. Still, global health officials are calling for calm. Roe Ruttenberg, CGTN in Washington.
Right, for more now on the coronavirus and China's response, let's bring in our panel. Joining us from Beijing is Anna Tangen. He's a political and economic affairs commentator. Here with us in the studio is Sweta Chakraborty. She's a risk and behavioral scientist. Also with us is Eric Ding. He's an epidemiologist at the Harvard Chan School of Public Health and an advisor to the World Health Organization. And from New Haven, Connecticut, Shi Chen is an assistant professor of public health at Yale University. Thank you to all of you for being with us. Eric, let me start with you. We talked about this just a few days ago. The situation has now escalated. The World Health Organization is now focusing on the Chinese response. This is what we heard from the WHO's executive director, Michael Ryan. Let's watch this.
During our trip to China, we were very impressed with the level of engagement of the Chinese government at all levels. Personally, I think myself and the Director General have never seen the scale, commitment of an epidemic response at this level.
So, Eric, major efforts by the Chinese government to combat this virus, but what is your assessment of what's happened so far, what's happening right now, and where it goes to from here?
Yeah, last week they punted and deferred the decision to whether to declare an emergency. But over the weekend, swarms of data from many research groups, including the Imperial Group, showed that the transmission reproductive number is quite high. It's 2.6, which means for every infected person, that person will infect 2.6 more people. And that is quite a pretty sizable number. And it's much higher than the seasonal flu. And I think a lot of experts are now very concerned whether we can contain it. So the WHO is convening an emergency panel tomorrow, whether to decide to declare. And I really think they should, based on all the scientific evidence that's come out in the past week, declare a global health emergency.
We also have something of a insidious development right now where people who are carrying the virus might not actually show symptoms.
Yes, and that is one of the critical differences from SARS. SARS, it was only contagious once you have symptoms, fever, cough, etc. And that allowed public health officials to quickly quarantine people before it got out of hand. But this new coronavirus, many groups have reported, including the Chinese ministry, that it can pass even when you have no symptoms whatsoever during the incubation period, which makes it much harder to contain because now anyone who is a carrier can pass it along even before they know they're carrying it.
All right, let me bring in Shi Chen. Shi Chen, the WHO, as Eric just mentioned, will reconvene its emergency committee tomorrow to determine whether this outbreak amounts to a public health emergency of international concern. What does that actually mean, and what would happen if they do that?
That means they will need more international coordination to fight against this virus. So it's not a single country emergency, it's a global emergency. So it will affect the people traveling, maybe shipments of goods and services. Those might be affected quite a lot.
And what are your thoughts on the fact that we now know that this virus can be carried by people who don't show any outside symptoms that they have any kind of sickness?
Yeah, there were different cases reported by different countries, but I think in most cases they are still developing symptoms. So I think there still need to have a public policy or public health response at different levels to address those with symptoms. But definitely we need to watch out the cases about asymptomatic cases and have those measures. And especially, I think it's important to know that the incubation period, the range of that, because that will determine like how long the travel ban and the holiday season should last in order to quarantine people to most effectively contain the disease.
And Shi Chen, when you say there should be a public health response at different levels, what would you like to see?
Yeah, I think now we already have the lockdown of major cities like in Wuhan and most of the cities there, and the change in the health insurance reimbursement, that's very helpful. Especially 3 days ago, they changed the policy to cover every case, including the suspected case. But at the provider perspective, like in terms of hospital, I think they could do more to use modern technologies such as telemedicine to diagnose people without a face-to-face meeting. And also they should uphold the tiered care system in order to screen people at the local community center, avoiding all people flooding into the hospital. So prioritize those with severe symptoms. That's very important. And I think since this is already a large human-to-human transmission infection, so it's very important at the individual level to have more public health education or health awareness, to frequently wash hands and understand how to best wear the face masks. Those are very important. For example, I think the public figures can stand out to show to the general public how to best wear face mask. And also, I think the panic is unnecessary, and it could only do harm to this crisis, because stress is not good for health. Right. And also stress will do harm to the distribution of very important medical supplies, for example, face masks.
Yeah. All right, let's go to Anna Tangen. He's in Beijing. Anna Tangen, President Xi Jinping, the Chinese president, he has met with WHO officials. This is what the president said after that meeting.
For the Chinese people, we are now in a serious battle against the epidemic. The Chinese government attaches great importance because the purpose of the government is to put the lives and health of the people at the top of all priorities. Therefore, I have been personally directing and deploying the epidemic prevention and containment work this time.
So, Anna, this is a crisis which affects, of course, millions of people, probably hundreds of millions of people in China and around the world. In China, entire transport networks have been shut down. We just heard that the government is building hospitals, emergency hospitals in the Wuhan area. What kind of impact is this having overall on the country?
Well, it's most people are trying to take it in stride. What they're doing is sending messages to each other to stay inside, to wear face masks. The streets here in Beijing are deserted. Not unusual for a holiday season, but certainly much more than in past years. So at this point, the people are kind of waiting and seeing. The difficulty is that there's so many rumors going around, so much false information online, which is being spread just because people, they mean well, but they're not doing well. I would really urge people to, if they want up-to-date information, go to respected medical sources, the WHO, CDC, and the Chinese equivalent of infectious disease, all have an up-to-the-minute site which is being created by Johns Hopkins. A site like that will give you real insight as to what's happening. Really, the largest danger here is, and I reiterate what my colleague said, is panicking. This is going to go on. We're probably not going to see a peak, from what I've heard, until somewhere later in February. So that means between this time and that, people are, their fears are going to run away with them. I think Xi's direct involvement is a way of trying to assure people that the government is doing everything they can, and I think that's abundantly clear, not only from the professionals of the WHO, but also from the people on the ground here. Most of them. There are always people who think something should have happened differently.
Sweta, there we heard that people are taking this in their stride. In fact, I spoke to one of our reporters yesterday who's in Wuhan. He's in the city that's been quarantined, and he said there's no sense of panic. People are going about their daily lives. They go shopping. There's no scramble for food or anything like that. Does that surprise you?
It's really good that people are behaving in a way that is not causing that public panic, because to get an overreaction can result in serious losses. We saw with SARS in the early 2000s, it cost upwards of $50 billion. And so there are some real consequences to these viruses getting out there because of the ripple effects that it has through society, that it has to the economy. So there needs to be appropriate measured response. And if we can result in 60 million people being cut off for the time being that is necessary to get this infectious disease under control, then that's what we need to do. But that's a very reactive stance to take. Ultimately, what we need to focus our attention on is proactively managing this risk and to be more preventative, because the ripple effects, again, as the trends increase towards increased urbanization, you know that transportation, people are closer connected than ever in densely populated areas. We need to stop an outbreak like this from ever even happening, rather than deal with containing it like we're seeing.
Right, you know, on the question of being proactive, of course, we live in a very closely interconnected world right now. I mean, every minute there are hundreds of millions of people on the move all the time, and these numbers are escalating. How does one get proactive about this?
Right, and in addition to transportation globally increasing, you also have an increasing population, and you have increasing demand for animal proteins. And so how do you begin to feed, let's say, 9.8 billion people on the planet by 2050? There's going to be a increased demand that is going to travel then ever more quickly throughout the globe. So we need to think about these trends and how we are going to manage masses of people who, rightly so, want access to the things that those who preceded them, as they've gained wealth and they've gained stature globally, have wanted. So it's really critical to recognize human behaviors, especially when they interact with animals, for either food consumption or for wildlife trade, to really nip it in the bud there. So if we can educate and improve human interactions with animals and recognize that this is a whole picture to take of human-animal interaction and the environment, and protect the habitats, and recognize that habitats are changing because of the changing climate, then we'll be able to get on top of it and be more proactive.
Okay. Eric, there have been reports that up to 100 people have been, quote-unquote, cured. What does that mean, to say that they're cured?
Well, I think, you know, this virus, it creates basically a viral pneumonia. And just like the flu, you can recover on your own. And your viral load.
Is this the body's own immune system that fights
it? Yes, yes. So this is one of those viruses that you can, I don't think it's worse than the flu per se. The case fatality rate so far seems to be lower than SARS. SARS had 10%. So we don't think the mortality rate is more than 10%. Your body can fight it. At the same time, no one has any immunity. Most of us have some background immunity to the flu, hence we don't always catch it, and there's a flu vaccine, which is, for most years, pretty effective. But right now, no one has immunity. That's why it can spread so much faster. But that said, we're working on a vaccine. The team are out there. They plan to get one in the field in 16 weeks, and hopefully test it enough to have one available by 6, 9, 12 months from now. And in the meantime, many other groups are testing many like HIV medicines, like protease inhibitors, that because it's an RNA virus like HIV is, maybe these antiviral drugs can also, meantime, slow down the virus progression.
That's right. We had this one report from the National Institute of Allergy and Infectious Diseases right here in the United States that says it is confident that phase 1 trials on a vaccine will begin within 3 months.
Yeah.
What does that give us?
It means that we will have the beginning stages of putting a vaccine into the field to test.
Right.
But that said, this is a very fast mutagenic, fast mutating virus. It's an RNA virus.
Yeah.
Like in one of the Lancet reports, there's 6 family members who were infected. All 6 have a slightly different version of the virus, which means it's a fast-moving virus. And we may not have a single universal virus like the measles, where once you get it, it's good for 10 years.
And you won't have a universal vaccine either.
Yeah, exactly. Yeah, this universal vaccine for, we don't know, it might just be seasonally, we might have to update just like the flu.
Okay. Xi Chen, at this stage of the outbreak, what are the biggest challenges, do you think, facing healthcare workers, healthcare professionals in this part of China? I mean, who are the most vulnerable people?
I guess as health workers, because they are in very overcrowded, overstretched hospitals and clinics. So, and in local areas, it's running out of capacity, but recently they are building new hospitals. So it's very important with new capacities, if they streamline the tiered care system to have a pre-screening and prioritize more severe symptoms to be treated, then that will ease the tension, overcrowded tension at the hospitals. That will be also doing good things for the health workers, reduce their chance to be infected, and also reduce the cross-infection.
Right, and what about older people and the very young?
Yeah, last week we still will believe that this may mainly affect the older persons, but now the new cases showing that the young people are also affected. So they are vulnerable group of people. So that's why at the beginning I was suggesting we should being less panic or less in fearness. So because that will disturb the efficient allocation of medical supplies to those more vulnerable people. And I would also strengthen emphasize the point that there are still about 5 million Wuhan residents out of Wuhan. So it's very important to destigmatize them and to let them smoothly return to their hometown. And if they are stigmatized, like in some news media, then that's will deter their care seeking because they were labeled. They are put some stigma. So I think that's unnecessary. They need to be changed. Yeah, because we are fighting for disease, not the people. The people is on our side to fight the disease.
Okay, Anna Tangen, Beijing reported its first death from the virus, and as you told us earlier on, there's a lot of rumors going around. Those rumors, of course, amplified by social media. I mean, we're talking about a city of 21 million people. Are there good lines of communication, access to good information on what is going on, and are people taking precautions?
Well, yes, I've noticed on a lot on the chat groups that people are tending towards getting the better information. And this is an aspect that has been very, very important in this, the transparency that the government has exhibited here. I mean, they're not pulling any punches. The leaders are getting out there and it's saying exactly what they think they need to do. And that is allaying a lot of this kind of backroom banter that people are trying to spread. I don't think they're doing it maliciously, but you know, human beings have a tendency to take two dots and try to connect them, even if they're not. So at this point, people, as I said, are mostly taking it in their stride. Everybody is staying away from any kind of group events and going forward. But I wanted to address one thing my colleague said. She indicated that you have to prevent any of these things from ever happening. I don't know that that's realistic. I think realistically things will happen and you have to have a response. And I think at this point, China is going to be setting the gold standard. The use of artificial intelligence to kind of monitor the spread of this, the quickness by which they were able to unravel the DNA sequence, very, very, very impressive.
Shweta, can we prevent things from happening by being proactive?
We can absolutely. We're talking about potentially 1.67 million unknown viruses that are out there and exist and are just hanging out in animal hosts, in bats and camels and turtles. And as the planet is changing, we know what's happening. We can anticipate it. I work with a group called Eco Health Alliance, and they do surveillance and mitigation of infectious disease around the world. They look and follow hotspots to see where the next infectious disease may emerge. And so we have incredible knowledge on the ground. We have field epidemiologists all over the world, and we've learned a lot from diseases in the past. So if we know that unique human interactions with new types of species that we haven't historically interacted with, like porcupines, like different bushmeats in Africa. Mares, for example, came from the Arabian Peninsula. If we keep watch of these different hotspots and unique interactions with these animals, we can potentially stop these existing unknown potential infections from taking hold, emerging, and spreading.
You know, I'll get you in a moment, Eric. A point you mentioned earlier on that the world population is growing, our lifespan's getting longer, there's greater demand for food, greater demand for animal proteins. But if you look at the situation here in Wuhan right now, there is one theory that this originated, the virus originated in wild animals. This is not, I mean, the consumption of wild animals, raw animals, have not started last week or last month. It's been there for a long time. So why does this virus now infect humans? Are there other factors contributing to this?
Sure, and that's exactly what's interesting about mutation of viruses, in that, again, it can be completely harmless to the host, to the animal that it's living in. Most likely this came from a bat, let's say, and then the interaction between the bat and the human, in that process, it became a little bit more nefarious. And then from human to human, it went even further. And so that mutation is really what we need to keep an close eye on, and it can change so quickly and rapidly that containment can become very tricky, which is why I emphasize as a behavioral scientist, if we can change behaviors from the get-go and be more proactive to prevent these infectious diseases from ever even seeing the light of day, that ultimately will protect us from a horror story like the movie Contagion. That's what keeps infectious disease experts up at night.
Eric?
Yeah, and I think prevention is a really critical thing. Oftentimes when we think of healthcare system, we invest in doctors, nurses, hospitals. These are important whenever an outbreak occurs. But in terms of public health infrastructure, making sure the sanitation, we have enough sanitation and inspections of restaurants, of seafood markets, of various other places, and investing in the prevention, surveillance, and monitoring, and basically preventive measures. Our public health infrastructure is always underfunded relatively to the doctors' hospital system per se. And public health is about, if you give an apple, you can actually prevent more disease than just treating on the back end. In the end, an ounce of prevention is worth a pound of cure. An ounce of public health investment is worth way more than reacting on the back end right now and suffering terrible economic conditions.
Right. Xi Chen, of course, this is now an international problem. We know that there have been people infected in more than a dozen countries. The United States is advising its citizens not to travel to China. It's in fact introduced screening procedures now up to 20 airports in the country. How essential is this? Will it help in the long term?
I think in the long term, if we determine as a few months, that could be a major impact because different airplane companies are changing their flights and schedules. So in the coming months, that will be affected. So, but the air flight industry, they are still checking the latest situation. So I think they are doing step by step. So they are cutting the air traffic, week by week. So they are doing very discretive measures to judge the situation. So I think it's very important to keep watching about the new suspected cases and confirmed cases from China. So that's very important. And I already saw some fluctuations in the new suspected cases and confirmed cases. That means we are a little bit closer to reaching the plateau, although it's still very far away. But once we are having a stabilized cases, then that means we are reaching milestones to combat this disease. So we are really look forward to that.
Okay, we're going to have to leave it there. Thanks to all of you for being with us. Before we say goodbye, we would like to invite you to listen to the Heat podcast. This week I spoke with CGTN correspondent Zhao Yunfei about his experiences in Wuhan. It's available through Apple Podcasts, Google Podcasts, Stitcher, and Spotify. I'm Anand Naidu in Washington, D.C. Thanks for watching.